Please remain seated and sound yourselves.
Good afternoon. Welcome to the commencement ceremony of the Julia Jones Matthews School of Population and Public Health. I'm Jerry Carino, Dean of the Matthews School. It is my honor to welcome our graduates, their families and friends, our community, and the community of scholars who have come to share in this celebration. It is also my honor to welcome our distinguished guests and the university officials who have come here to celebrate you, the graduating class of 2025. Dr. Ted Mitchell is our Chancellor of the Texas Tech University System. Dr. Lori Rice Spearman is President of Texas Tech University Health Sciences Center. Dr. Amal Mitra is Chair of the Department of Public Health. Dr. Rick Danko is the Associate Dean for Academic Affairs. Dr. Courtney Queen is the Associate Dean for Strategic Partnerships. Dr. Jeff Dennis is the Assistant Dean for Student Affairs and Director of our Applied Practical Experience. Students will recognize our faculty. Faculty, will you please stand? We celebrate commencement at the end of an academic journey, yet the word itself, commencement, A Time to Commence, reminds us that this is not the end, but the beginning of a life's work, a career, a calling, in which we put science into service for people. Today's graduates have boldly faced and prevailed in an academic program of rigorous science, mathematics, project management, change strategy, policy development, policy analysis, and even a dose of individual and social psychology, just to name a few. Those who walk the stage today are eminently employable and ready for the work source. Today's graduates are the ones who will promote healthy lifestyles, research and prevent disease and injury, detect, prevent, and respond to the next outbreak or epidemic or pandemic of infectious disease. Yes, one of those is going to come sometime in my lifetime, I'm sure. And they're the ones who will save our neighborhoods and our communities of West Texas, our great state, our country, and our world trillions of dollars and countless years of life lost to death, disability, and disruption. I bet no one there can fix my mic, though. Thank you. Today's graduates are the unsung heroes of the bad things that didn't happen. Population and public health are all about community, collective action, and building one good idea or innovation atop another and another and another. We at the Julia Jones Matthews School of Population and Public Health have been the beneficiary of such a community effort. We owe our very existence to it. More than a decade ago, our community, folks like Chancellor Mitchell, community member Joed Cannon, and of course the Matthews family, had the prescience to build an institution. They foresaw an essential need, the need to prevent the bad things and the really bad things from happening. Is it back on? The need to promote health and wellness, not just to treat sickness after the fact. The need to understand deeply, oops. Is it on?
Change it out.
Okay. There are like 16 more pages, don't worry.
Don't worry, no mic change just coming.
Is that on? There it is. The need to be really agile when you're standing in front of about 700 people. The need to understand deeply those behaviors and structures and environments and situations that yield good health or contribute to bad health. Ladies and gentlemen, through the vision and efforts of a few, through the generosity of the wonderful Matthews family in this strong community, and through the hard work of these graduates who will walk the stage this afternoon, West Texas and our world are far better, healthier, and more productive place. To the class of 2025, sitting right over here, and the August and December graduates of 2024, I offer my sincere congratulations and my thanks for all you have done and all you will do in your careers. I welcome to the podium Dr. Ted Mitchell, Chancellor of the Texas Tech University System, for his remarks.
Days like today are fantastic because we get to celebrate the culmination of everything that an academic experience is supposed to be. It's also, for us, a culmination of what can happen when you have tremendous community support. I remember it was about a decade ago that I was sitting in a conference room not far from this theater with a group of folks from this community that included the Matthews family, included Joed Cannon, and included a handful of people that were wondering how they could support the Health Sciences Center in a mission that would impact not just Abilene, but all of West Texas and beyond. And so we were having this discussion about population and public health and what that actually meant, because it's one of those things that on the front end of it, when you say a school of population and public health, it requires a little bit of an explanation. But the way I always like to describe this is the folks that graduate with these degrees, they become in the best sense of the word, a Sherlock Holmes for the communities. Why is it that in this particular community, you're seeing children with lead poisoning? Why is it that you're seeing a cluster of influenza break out in a certain area? Why is it that you're seeing things happen and it's the folks that are trained in public health that wind up putting the pieces of a jigsaw puzzle together so that the practitioners, the physicians, the nurses, the PAs, the pharmacists can then focus in on the individuals. And so schools like this are critically important. As the dean said, you will be immensely employable because of the skill set that you will have developed from the experience that you had here. So what I would say to the graduates is very simple. I'm paraphrasing Albert Schweitzer. I can't tell you what your destiny will be, but I can tell you this. I know this. Those amongst you that will be truly happy will only be those who have sought and found a way to serve other people. This degree is a perfect degree to help you serve other people. Congratulations.
I now welcome to the podium Dr. Lori Rice Spearman, President of the Texas Tech University Health Sciences Center, who will deliver the President's Address. Dr. Rice Spearman.
Good afternoon. And on behalf of the Texas Tech University Health Sciences Center, we welcome family, friends, and loved ones to this momentous occasion. And now I would like to speak to our graduates. You've pushed through rigorous coursework, field experiences, sleepless nights, and unspoken challenges. And now here you are, ready to step forward. And as the faculty and the staff of the Texas Tech Health Sciences Center, we see our future in your faces. As population and public health professionals, you've chosen a calling to serve entire communities. Yours is a path that leads compassion, puts people first, and seeks the root causes of health. Public and population health is a discipline often behind the scenes, outside of major health crises, but its impact is undeniable. You are the ones who will prevent illness before it begins, who will speak for communities too frequently left out of conversations, and who will translate data into action, policy into progress, and care into justice. You leave here today as scientists, analysts, educators, clinicians, and advocates, but above all, as champions of health. You carry the truth that a person's zip code should not determine their health, but far too often it still does. There is much work to be done. Life expectancy, maternal health, and chronic disease can all be mapped by a neighborhood. That's not just a statistic. This is a call to action, and you are the answer. Before I close, let me offer my deepest thanks to the Amarillo community, which has supported our school and these students. We're also grateful to the faculty and the staff and the leadership of this outstanding school. As you walk across the stage and into the next chapter, remember this: your work may not always make headlines, but it is going to change lives, because you are going to meet people where they are in their communities. Congratulations to this wonderful school, the Julia Jones Matthews School of Population and Public Health, today as we celebrate you and the future that you are going to bring to the communities. Thank you.
So many brought us to this day and to this celebration. Thank you to our faculty and staff who have demonstrated tremendous resourcefulness and commitment to the mentoring and education of our students. I also acknowledge and thank our Chancellor, Dr. Ted Mitchell, and President, Dr. Lori Rice Spearman, for their distinguished leadership and support. Thank you to the family and friends of our graduates for supporting them to hear this calling. You know what you did. and we do too. You sacrificed, and you waited, and you anticipated, and you dreamed, and you aspired, and maybe you even cried a few times. We see you, and we appreciate you. Graduates, let's give our family and friends, our faculty and our leadership a round of applause. Three graduates and one alumni here today have distinguished themselves in the field of public health and will be awarded based on applied practice, community service, overall scholarly excellence, and being a distinguished alumna. While many of our graduates have done exceptional work, both in and outside of the classroom, the graduates who follow were selected after rigorous review of nominations by faculty and staff. I welcome to the podium Dr. Jeff Dennis and Dr. Courtney Queen to present these well-earned awards.
Thank you, Dr. Carino. The Outstanding Applied Practice Experience Award recognizes and celebrates that the Master of Public Health is a decidedly applied degree. Our graduates make a difference not only by thinking, but also by doing. All MPH students must complete the Applied Practice Experience, where they develop and direct their own projects with a partner community organization. This year's recipient developed a hepatitis A prevention project for Cameron County, Texas Health Department. It is my honor to present the Outstanding Applied Practice Experience Award to Stephanie Martinez. Stephanie was unable to attend the ceremony today, but we will make sure she receives her award. So let's please give her a hand.
Established last year in recognition that public health is for the community, with the community, and of the community, the Outstanding Community Service Award honors the graduate who best exemplifies science and service to the people. As co-chair of the Julia Jones Matthews School of Population and Public Health Community Advisory Board, it is my honor to present the Outstanding Community Service Award to Bindika Patel.
The graduating student who best exemplifies a wide array of public health acumen and service to the population as a whole is awarded the Outstanding Public Health Student Award. The nomination for this year's awardee highlighted his strong dedication to excellence in coursework and his commendable efforts toward research and community service. It is my pleasure to award the Julia Jones Matthews School of Population and Public Health Outstanding Public Health Student Award to Toby Oladeji.
In 1999, the Office of Alumni Relations began recognizing our alumni to honor their accomplishments and contributions so that these outstanding alumni could serve as an inspiration to their colleagues and future graduates. Awards are presented to those alumni who have achieved a high level of success in their chosen fields and whose efforts have made a positive impact on community and humanity, bringing distinction to themselves and to Texas Tech University Health Sciences Center. This year, the Julia Jones Matthews School of Population and Public Health is proud to announce its inaugural recipient who was selected for this prestigious award. Ladies and gentlemen, it is my honor to present the Distinguished Alumni Award to Christine Lucio.
Okay, this, you should hold it. Okay. Never in my life did I think I'd be standing before you to receive an award like this. It is such an honor to be recognized and truly a blessing to have started my public health journey with Texas Tech. For me, public health wasn't plan A. Instead, my path started with a career in social work where I provided counseling services in rural Alaska. I worked with children and their families facing some of the hardest challenges you could imagine. I'd help them develop new strategies and skills, and then when they were done, the next family would come with some of the similar struggles. It was incredibly meaningful work that I loved, but my office started to feel like a turnstile. I was seeing so many clients with the same struggles over and over again, and I couldn't shake the feeling that I wasn't addressing the bigger picture. I wanted to do more than help people cope. I wanted to prevent the suffering that brought them into my office in the first place. That purpose led me to public health, because public health asks, how do we develop the conditions where people don't just survive, but thrive? Public health asks, how do we address the policies, systems, and environments that shape health outcomes long before someone ends up in the exam room or in a crisis? My desire to prevent the suffering I was seeing on a daily basis ultimately led me to public health. Public health wasn't just a career shift for me, it was a calling, and Texas Tech helped me bridge that transition. As many of you know, Texas Tech's program is unique because its approach goes beyond the theoretical. You have multiple opportunities to get out of the classroom and into the community. The knowledge and experience I gained at Texas Tech helped me turn my desire for change into real impact. It allowed me to better understand community-based prevention and response, program development and implementation, research, and policy work. These skills and the opportunities I was afforded ultimately led to my role as the Assistant Director at the Abilene-Taylor County Public Health District, and to my current role at the CDC, where I focus on diabetes research, prevention, and management. As you all begin your careers in public health, know that the knowledge and skills you've developed during your time at Texas Tech are invaluable and needed everywhere, not just in traditional public health spaces. Texas Tech has cultivated each of you into leaders and innovative change makers at a time where public health needs you the most. Also, recognize you're not entering the field alone. Look around you. Your classmates are now your colleagues. Your professors continue to be your champions. And previous alumni, they can be your mentors, colleagues, and friends. Public health might be small, but it is mighty and well-connected. I say all of this to remind you, public health is not to be done alone. Take advantage of your network, expand your network, and continue to connect with your communities. Robust relationships and active communication will be the key to your success for your future and the future of public health. Thank you again for this honor, and I congratulate all of you on your achievements. Thank you.
Thank you, Christine. Thank you, Dr. Queen and Dr. Dennis. Let's give all of our award winners one more round of applause. We have an extra special treat today, one that I cannot do justice to in my introduction. So I'm going to bump it up a notch. I'm going to talk to my boss's boss's boss and ask him to come up here and to introduce our keynote speaker. Dr. Mitchell?
Y'all are in for a treat today. Who in the room was born after the year 1970? Raise your hands. Raise your hands. Raise them high. I can see out there. Okay. Those of you that were born after 1970 are going to have a hard time understanding what I'm about to say. Those that were born prior to 1970, if you were driving a car down any typical town on the road, let's say in 1960, and you see on the sidewalk somebody running, your natural tendency in 1960 would have been to look behind them to see who is chasing them. That was the world that we grew up in. Those of you that were born after 1970, if you're driving down the road today, anywhere in America, anywhere around the world, and you're driving along and you see somebody jogging alongside of the road, you don't even think twice about it. You don't even blink, because it's part of the world that we live in. That world was created by pioneers like the fellow who's going to speak to you for a few minutes, Dr. Kenneth Cooper. Dr. Kenneth Cooper is in his 95th year. He's called the father of the modern fitness movement. Prior to the 70s, exercise was considered to be something that you did as a sport. Once you finished school, you quit exercising and you went to work. It was something that was considered just to be a recreation. It was not something considered to be part of an overall health program. Through years and years and decades of science, Dr. Cooper and the team that he assembled set out to prove that using physical activity as part of an overall health problem would change the way that medical care was delivered and change the way medical outcomes occurred in the United States and beyond. He has a career that goes back that could have taken turns at any number of directions. He was a decorated officer in the United States military. He worked with NASA astronauts on devising programs that would keep them healthy while they were in space. He worked with medical equipment designed to test people in various aspects of cardiovascular training. And he put together a research institute that houses the largest set of data that exists on the planet when it looks at physical fitness and the impacts that has on long-term health. We've been fortunate enough to have the Cooper Institute join the Texas Tech University Health Sciences University as part of one of our institutes so that we can continue to work on this area. It is not often at a graduation ceremony or in general that the audience gets to hear from someone who is truly an American icon. So please join me in welcoming Dr. Kenneth H. Cooper to the podium.
Thank you, Chancellor, for inviting me to speak here today, and I apologize for my walking, but after running for 38,000 miles in 40 years, skiing regularly, snow skiing, in 2004, after 50 years of snow skiing without a problem, I fell and broke my leg, tibial toe fracture. So since then, I've been trying to continue with my exercise. I had to give up jogging and skiing and all that. But I remind you that fitness is a journey, not a destination. You have to keep up the rest of your life, expect to be beneficial from you. I'm in my 95th year, graduating class in medical school in 1956, University of Oklahoma, 106 members in our class, only 9 of us left. Because back in the days when I was in medical school back in the 50s, I was even in high school, I was warned about exercising too much because you get an athletic heart. My father, practicing dentist in Oklahoma City, where I was born and raised, rebelled against my playing basketball and running track. Even though he didn't encourage me, he didn't keep me from making All-State in basketball, Oklahoma, and win the state championship on the mile run when I was a senior in high school. But he was afraid that athletic heart would get enlarged, muscular, and once you stop exercising, you convert it into fat, and you would die early. I was taught the same thing in medical school back in the 50s. Exercising too much is detrimental to the body. It's not going to prolong your life, it's going to shorten your life. Little did he know that I could continue this exercise and outlive him by some 18 years. He died at 77. Trying to understand that there was beneficial effects for taking care of your body, because your body is your responsibility. It's not the government, it's not the insurance companies, it's not your personal physician unless they're trained in preventive medicine or lifestyle medicine. They don't know what to do or what to say. So starting from scratch in 1968, the publication of aerobics, I coined the word in 1968, read my first book. There was a tyrant of resistance against what I was saying. I want to share some of these things with you, because I want you to learn about my experience so you can not make the mistakes that I made and benefit from perseverance. Is what you need to do. Continue what you're doing. The book came out. Surely I was besieged with such comments. The streets going to be full of streets going to be full of dead joggers. 1968, 150,000 joggers in America. By 1984, we had up to 30 million people jogging. More than that, around the world. Did heart disease go up? It went down during that time. We weren't killing people, we were saving lives. Well, after a 13-year career in the military, back in 1970, I worked up the rank of lieutenant colonel. Had a promising career in the military. I had been Surgeon General, though they told me if I'd stay in the military. But the contrary, I read a book entitled Halftime by Bob Buford. And he said this: you can be successful in life, but not significant. I was successful in the eyes of the military, but didn't think I was significant. So I decided to leave after all that time, the 13-year career, and establish my own little organization in Dallas, Texas. 2 offices and 2 employees at Cooper Clinic. But I actually saw my first patient December the 6th, 1970. But I actually chartered the nonprofit 501c3 Foundation Cooper Institute 6 months before I saw my first patient, because I had to have data, objective data, to prove what I was saying in that first book was correct, and it would prolong your life. It would enable you to enjoy a better life. I had to go before the Board of Censors, Dallas Medical Society. I was doing something as dangerous as treadmill stress testing. I pioneered that in the Air Force for NASA. Worked with the astronauts to be able to read an EKG when these astronauts were in space, particularly extravehicular. We didn't have that back in the early days. So Bill Thornton and I worked together on that to get that. And so we now passed over 300,000 maximum performance treadmill stress tests. On a daily basis, have people coming to the clinic thinking they're perfectly healthy. We see up to 200 patients. We come from all over the world, and they come in thinking they're perfectly healthy. We find they have a high coronary calcification score with our CT scan. Put them on the treadmill, and they have abnormal stress tests. No signs or any symptoms, but then find with a CT angiogram, they have severe obstruction. Happened just last week in a man about 50 years of age. Had no idea he had potentially a deadly thing in his life. LAD, the widowmaker, almost totally excluded. Immediately had bypass surgery and saved his life. That's happening several times a week because the most common first symptom of severe underlying heart disease is sudden death. They realize that until it's too late. So with that, we started this research institute, and I collaborated, as Ted said, with the Texas State. We're going to the next step. We've now published in the past 54 years, we've published over 700 papers, bridging the gap between faddism and scientific legitimacy. You exercise the practice of medicine. It truly is amazing what's happened. I want to share 2 stories with you, 2 studies with you. Number one is we took a group of 28,000 patients. It came to the clinic, average age of 50. 1% were women, all healthy. We followed for 25 years, got the Medicare data from 65 to 75 years of age. And the only variable we looked at was their time on the treadmill. Very poor, fair, good, excellent, superior. Compare the top category of fitness with the bottom category of fitness, all healthy. These people had 36% less Alzheimer's dementia than the bottom category. They had 40% less chronic kidney disease, requiring dialysis, than the bottom category. They had 25% reduction in all types of cancer, and they had 25% reduction in congestive heart failure as compared to the bottom category. But the amazing thing, from 65 to 75 years of age, the cost of healthcare was 40% less in this group than this group. Been able to show for the first time that you can prevent Alzheimer's dementia. You can reduce the cost of healthcare. To the contrary, we spend an average of $3.4 trillion on healthcare every year in this country. Yet we rank 43rd in longevity. Many countries around the world are living longer than we are because too much care, too late. We spend way too much of our health service dollar on desperate measures that often prolongs death, not life, a miserable few days. We're trying to change that attitude. Preventive medicine. I had no idea I'd become a specialist in preventive medicine because I was taught in medical school back in the 50s that preventive medicine is the Cinderella of the medical specialties because there's no profit in health. The profit's in disease. They told me when I first came to Dallas in 1970 at Southwestern Medical School, you cannot be successful practicing medicine in Dallas if you're taking care of healthy people. I have a database of 150,000 patients. They've come to our clinic from 1 to 54 times. We did a study evaluating 100,000 patients who come to our clinic at least 20 times over a 45-year period. And we got the death certificates and found that our women were averaging 90.4 years, our men averaging 86.5 years, an average of 88.6 years for our men and women, which is 10 years longer than the national average. Been able to disprove it with all these articles now published. We'll have more of these now, collaborating with Texas Tech at the institute they have, School of Public Health in Dallas. But this is all being caused as a result of one final thing. That's what we call getting Cooperized. I want you to listen carefully because these are things you can do now. And keep in mind, no drug can replicate the benefits of an active lifestyle. And one on that list, get your weight under control. You can't be obese and be healthy. There's just too many problems associated with that. For years, we have used the body mass index, height and weight. 18 to 25 is normal. 25 to 30 is overweight. 30 to 35 was obese. Above 30 is morbidly obese. Above 40s. And America is suffering. Our kids particularly are suffering with obesity and inactivity. Get that body changed. And now there's a new way called the Body Roundness Index, BRI. Because one thing we're ignoring is where the fat is located. Now, if you have a pot belly, that's a visceral fat. That's a dangerous type of fat. You can't just rely upon that, beginning the height and the weight. You must get the circumference of your waist. Instead of going to the internet and trying to figure your body around this index, keep this in mind. Take your height in inches and divide it by 1/2, and that should be the maximum that your waist circumference should be. 6 foot in height, that's 72 inches. A waist circumference would be a max of 36 inches. Take that in mind because that's the fat you want to get rid of. Number one, body weight. Number two is proper diet. For me, I have a standard rule. 5 is fine, 9 is divine. Number of servings of fruits and vegetables should be consuming on a daily basis. Average American adult, 3.1. Average American teenager, 1.6. We need to change our diets. The new Director of Health and Human Services is trying to do with the processed foods, some of these things, and the diets and all these things. It can be complicated, but make it simple. Try to get your fruits and vegetables, as I said. And one other thing is I strongly recommend the supplementation of vitamin D. I take it myself. Because we found during the COVID epidemic that people at high levels of vitamin D weren't hospitalized as much and didn't die as much. Yet to the contrary, people of color who can't manufacture vitamin D through their skin, they had a 5-fold increased risk of hospitalization, 2-fold increased risk of death because they couldn't manufacture through their skin. So I take 7,000 units a day. I'm not recommending you do that, but you take at least 2,000 units a day because getting that vitamin D up, it counteracts that cytokine storm that's causing the damage to the virus that goes to the lungs and causes pneumonia, which is the most common risk for dying from COVID is being over 65 years of age. I've had COVID twice, Omicron, because I had that high vitamin D. I was just quarantined for 5 days. All I had was a headache. And my age past page 90, I should have died. But the second most common risk is being obese as the cause of death with COVID because vitamin D is fat soluble. It can't be utilized to counteract that effect of the virus. So all these things are important. We've combined them with our getting Cooperized. So next on that list is you must exercise. I used to think if you didn't run distances, politics, I did by my many, many years, and I didn't get that athletic heart. I thought I had an athletic heart, but to the contrary, that heart wasn't enlarged. What it was dilated. And why do you think that when a person becomes aerobically fit, there's a reduction in the resting heart rate? Average American male, 72. Average American woman, 78. That goes down into the 40s and 50s. You get aerobically fit. Why? Because the good Lord has arranged for us to have a dilatation of the heart. So every time that heart isn't muscular, nearly as much as it's dilated, you pump out more blood with each stroke. Conservation of energy. In my advanced stage, my heart rate still runs in the 50s and 55s. I no longer run, but I use a recumbent bike to get that 30 minutes collective or sustained. I'd spend 30 minutes on the bicycle. And then I spend at least 10 minutes on a circuit weight training program. Because you get past 50 years of age, you have what is called sarcopenia. You start losing muscle mass unless you do something to compensate for that. And so we have a recommendation. During your 30s, you have 80% aerobic activity and 20% musculoskeletal conditioning. By the time you get to 50 years, at my age, it should be roughly 55 and 45. You have to increase that exercise as you get older, muscular type exercise, not just aerobic base, you need that, but you have to add the additional thing. The 30 minutes collective or sustained, both days per week. Next on that list, you can't use tobacco in any form, even vaping has its dangers, even side stream smoke has its danger. Don't be guilty of using tobacco in any form because it's related to so many diseases. Use of tobacco around the world is probably the most significant risk factor that we need to correct. So eliminate tobacco in all forms. Next is alcohol. We've had some contradictory evidence coming about alcohol. For years, we were taught that you could drink moderate amounts of alcohol and that'd be an advantage to you. That men could drink 2 drinks a day, 14 a week, and women 1 drink a day, but 7 a week. That was a standard for many years. A couple of years ago, a big study came from the European studies, and they showed that if men drank 2 drinks a day or 14 a week, they shortened their lifespan by 1.5 to 2 years. But now later data is showing that alcohol of any type, whether it's wine or beer or hard liquor, increases the risk of cancer. Yes, cancer of the oral cavity, cancer of the vocal cords, cancer of the esophagus, cancer of the colon, and ladies, cancer of the breast is related to alcohol. So I don't drink. I never have consumed alcohol. I'm about to start. Next on that is very important, that's stress control. Like what Hans Selye once said, the stress is the spice of life. But like there's no run, no hits, no errors. Stress has made me successful. I've had to compensate by the end of the day of a stressful that I get to the office or in the morning and I work out before I go home. I have my prayer and Bible study first thing in the morning at the office, but I work out so I can sleep at night. Because sleep is a very important thing to prevent Alzheimer's dementia. You should be getting at least 7 hours of sleep per night. That's a very important way of controlling stress in your life. And that final thing is get an examination. And we have a very expensive examination at the clinic. I know that. That's not really possible. Most people around the country, around the world to do, but they come from everywhere. And we have at the present, we've had as much as a 6-month waiting list. People trying to come to our clinic for examinations. It's given a database, it's mentioned that it's unparalleled. And all these people have had these maximum performance treadmill stress tests. We have the only database in the world in which we've used objective measure of fitness, that's time on the treadmill. Everybody else has used a questionnaire, just ask people what they do. We found people answer that question, give you the answers they think you want, they exaggerate, sometimes just outright lie. They do that about their weight. Just kind of double that, about their smoking, whatever they do. They tend to exaggerate. They don't tell you the truth with that. So again, we've looked at these things, but even if you can't have the comprehensive examination, get these things done at least. Get your height and weight and your circumference of your waist. Get your body mass index, body roundness index. Get that. Get your blood pressure, very simple. That can be done very inexpensively. And get your lipid profile. That's your cholesterol, your triglyceride. Get that. And get a test for blood sugar to determine whether you're a diabetic or not. And then finally, if you must get what we call is a C-reactive protein, because a C-reactive protein is a measure of chronic inflammation. And that's something we've ignored in medicine for so many years, because we know for facts, as we pointed out, you can have a brain full of amyloid plaque and tau protein, which is typical with Alzheimer's and dementia. But you have something to activate that. People will have a full brain full of amyloid and plaque just naturally as they grow older, but they never develop dementia because they don't have chronic inflammation. That's because of inactivity or obesity or some previous infection you've had in your life, and you measure that by the C-reactive protein. But in Dallas, I have a lot of pros, I have a lot of cons. One of my friends said he didn't want to come to the clinic because the examination was too expensive. Yes, it is expensive. But I'd like to ask them, would you pay for the insurance on your car last year? Would you pay for the insurance on your house last year? You can build a new house, you can buy a new car, but you've got only one body. And the most common first symptoms that it says, sudden problems, is sudden death. Keep that in mind. Our bodies are critical. We need to handle them with care and take care of them. According to genetics, we should live 120 years. It's not because of design deficiency, but the way we treat our bodies. But now we're seeing this increase in longevity. We're seeing the results of people being Cooperized. My new book is not coming out. It'll be released in June the 23rd. It's entitled Growing Healthier as You Grow Older. What I've summarized in this book is how to do it, but also share with it the experience of my life, autobiography. But all the resistance, the criticism, going before the Board of Censors, I could have turned back and given up. In fact, I got so depressed the first couple of years I was in Dallas, a little tiny office, and people were on my back. The guy county medical society tried to run me out of town. And my wife asked me, do you think what you're doing is right? Gave up that career in the military, could have been promising. And I said, Millie, I know it's right. Because I had an epiphany in my life that changed me from being an ophthalmologist, although I would be when I finished my internship in Seattle. But I had an epiphany, and I was deferred from the military during the Vietnam conflict by the Berry Plan, so I had to pay back 2 years in the military, ended up being 13 years. I went water skiing up at Lake Texoma. And I'd water skied in my youth, skied very effectively. Tried to stay a scholar course. I was 29 years of age. About halfway through the course, I got hit with chest pain. My heart was racing out of my chest. They got me over to the side, got me on the beach there. By the time I got over there, the heart pain had disappeared, and the heart is going back to normal. So the next day, I was still in the Air Force. I was evaluated to School of Aerospace Medicine. I had gained because of the stress of going through medical school and going through internship. I didn't have time to exercise. I've heard that before. So obesity is the most common manifestation of stress. I had increased from my running weight in high school and college from 168 to 204 pounds. In that deconditioned state, tried to exercise, as I said, at water skiing. I was pre-diabetic, I was hypertense, and the only thing wrong with you, doc, you're out of shape. That was at 29 years of age. And so I lost the weight within 6 months, ran my first marathon a year later, ran for all these years where I had to stop. And all those things disappeared. High blood pressure disappeared, the diabetes disappeared, and now only a very few of my medical school classes, as I said, are still alive. They didn't have that epiphany. They changed my life, my career, because I wasn't planning on being a specialist in preventive medicine, trying to help people help themselves. I think that is all because of divine intervention in my life. As a young man, 18 years of age, Southern Oklahoma, at the Balls Creek Baptist Assembly, I dedicated my life to become a full-time medical missionary to China. I had no idea when I made that decision. I kept it on the back of my mind. Now I've been to China 13 times. We have a center in Nanjing, China. I met with President Xi back in 2013 in the island of Hainan. I have close contacts with China. In fact, recently I had some people from China come and visit with me, want me to join forces with them to build a big center, a big hospital on the island of Hainan, which would be international tourism, medical tourism, to come there. And there's a house. This woman has some 5 different hospitals in which it's kind of a concierge type program. And they have acute care, and they have preventive care, acute care, and rehabilitative care. And 190,000 people now involved, approved by the Chinese government with that type of program, with the concierge type program. So they want us to join us. They want to have the Cooper name to bring to a post. They want to improve the type of preventive examination that we have, which has been ranked number 2 in America the last 10 years, behind only the Cleveland Clinic. They want the name. And so I asked permission from the State Department. Could I do that? And so I had a comment from Pete Sessions, our congressman. He went back and he said, with glowing reply, he said they would love for you to do that. Because that relationship that I've had with China, relations with China, I'm better known in China, the United States, may help this relationship that we have between China and America at the present time. I've had a charmed life, a wonderful life, a God-driven life. There's been so many epiphanies I could tell you about that changed the direction of my life. I've been married now to a wonderful wife for some 65 years. We have a son, a daughter, and we have 5 grandkids. I've been blessed. But I hope you all listen to what I said, because you're going onto a new career now. I hope you're motivated, number 1, to take care of your health. Take care of yourself. One of those precious gifts we have is good health. We don't appreciate it until we lose it. Keep that in mind. But it's what you do from now on determines how healthy you're going to be and how successful. Because successful and good health go together. If you're sick all the time, obesity and active don't do anything, you don't have any energy. And one thing that we've noticed, that people who are physically fit, they become less depressed, less of a hypochondriac, improved self-image, much more positive attitude towards life. And that's the way that you want to feel. And in this book, we're telling you a way to do that, even at advanced stages, how to change your life, enjoy life, square off the curve, That's what we call dying suddenly. We found in our people, living this long years and then dying suddenly. If I die tomorrow, praise the Lord, I've had a wonderful life. Can you say that? I know where I'm going. I want to close with this statement. It's found in Isaiah in 40:31. And you must embrace the concept of accepting the Lord if you want to sprout wings and soar like an eagle and run without falling, run without fear, and walking without fainting. Also in 1 Timothy 4:8, it says, for physical fitness is all right, but spiritual fitness is what you need, because that prepares you not in this life, the life in the hereafter too. My final recommendation is to congratulate all you graduates. I hope you'll benefit from what you've heard today and make this a life priority for you and your family, your friends, to get Cooperized. I'm trying to do this with Change the World. God bless you all very much. Thank you.
You know, Webster's dictionary literally added the word aerobics because of Dr. Cooper. Ladies and gentlemen, one more round of applause for the father of aerobics, Dr. Kenneth Cooper. I think I've lost my gym membership, but it's... We've got a reception after this. This is in the building next door. If anybody sees me eat anything besides fruit, just take it out of my hand. Thank you, Dr. Cooper. We are now going to proceed with the conferral of degrees, and I ask Dr. Rice Spearman, President of Texas Tech University Health Sciences Center, to please join me. Will the class of 2025 and those who completed the degree requirements in 2024 please rise? Chancellor Mitchell, President Rice Spearman, degrees are awarded to those who have successfully completed all requirements established by the Texas Tech University Health Sciences Center and the faculty. On behalf of the faculty of the Julia Jones Matthews School of Population and Public Health, I present to you, Dr. Rice Spearman, the candidates for the Master of Public Health degree and recommend each for conferral of the degree.
Are y'all ready? By virtue of the authority vested in me by the Board of Regents of the Texas Tech University System, I confer upon each student here today the degree for which the Dean of the Julia Jones Matthews School of Population and Public Health has recommended. Congratulations.
We will now proceed with the recognition of individual candidates. The following individuals are being awarded the Master in Public Health. Isra Abdallah. Anika Bushra. Matthew Cavender. Dr. Rajiv Chibundu. Chandler Culberth. Lamordia Dayamba. Ziana Atati Dunn. Bradley Engel. Before we continue, I would like to invite Dr. Carino to the podium for a special announcement.
Ladies and gentlemen, the 400th graduate of the Julia Jones Matthews School of Population and Public Health,
Maricela Esparza.
One is next.
401. We'll just keep going. Karina Rose Goodart. JC Derby Hart. Anasuya Jiwali. Andrea Lara. Olawatobi Oladeji. Bindika Patel. Emily Wynn Pham. Rafaya Razak. Abu Bakar Mohammed Rogers. Erica Saldana Bullock. Ruby Ray Sanchez. Amit Thar. Vera Grace Tidwell Dalton. Samantha Wimberly. Zawah Zabin.
Ladies and gentlemen, it gives me great pleasure to present to you the graduating class of the Julia Jones Matthews School of Population and Public Health. Please join me in celebrating the achievements of these great graduates. And especially for those of you who have been here from the beginning, please help me in thanking the faculty and staff of the Julia Jones Matthews School of Population and Public Health for graduating 413 graduates. Following our ceremony, we ask that you remain in the theater just long enough until the graduates have exited. We're going to take some pictures out in the lobby, and it'll get a little crowded there in a bit. So if you let the graduates exit and let the faculty exit, we're going to take a quick picture and then everyone can exit. We're going to have a reception next door at the Hotel Wooten, which is located outside. You have to leave the theater, leave the front glass doors, and take a right and take another right. I swear last week there was not wood on the ground covering the sidewalk and there was not police tape up. There are no chalk outlines anywhere nearby, so we don't have to worry about that. But the entrance to the Hotel Wooten, which is part of this building but has a separate entrance, is right around the corner, has a beautiful lobby. We'll go up to the second floor reception area and we'll have some refreshments there, and I promise I'm not going to overeat. Also, please remember that the Texas Tech University Health Sciences Center Spirit Shop is upstairs where items are available for purchase if you'd like to get something for your graduate. And I thank you all for attending. Please stand for the recession of our leadership, our faculty, and our graduates.